my background is that I'm a practicing neurologist, and then I'm seeing stroke patients. And when we started this project, I was a working physician at the local stroke unit, and we continuously have that problem that, there's a patient coming in with stroke-like symptoms, but we cannot really say within the first couple of hours whether this is an ischemic stroke or whether this is potentially also an epileptic seizure and just following the seizure, or whether this is a migraine attack associated with neurological symptoms. But this has therapeutic consequences. Ischemic stroke patients we would like to treat with thrombolysis, while obviously patients not having a stroke we wouldn't like to treat with that potentially harmful also treatment. So we need biomarkers to differentiate these two. And our current gold standard, which is usually very helpful, neuroimaging, and is widely established, cannot really differentiate between these two within the first couple of hours after stroke. And that is CT imaging, what we usually do. An MRI would obviously always help, but this is rarely available in the acute phase in an emergency setting. So we set out to look for blood-based biomarkers, something that is, on in the mind of people for now a long time, but hasn't been that successful in the early 90s and early 2000s when people focused on rather neuronal proteins such as S100 beta or GFAP or neuron-specific analyase. So we took another approach. We went out for metabolomics, which is a technique to cover a couple of hundred metabolites within the blood of patients. And basically it's an omics technique that profiles the circulating metabolome that would allow us to take an unbiased profile of what happens after stroke, because we found that there's, the obvious differences in the stroke pathophysiology compared to what happens in stroke mimics, for example. So epileptic seizures or so. So, and we had the hypothesis that that would be reflected within the blood of these patients. So we compared patients, healthy controls, also obviously patients with stroke mimics and patients with ischemic stroke across different stages in a discovery cohort, in a validation cohort, in a replication cohort, and came up with a panel of 4 metabolites, which is pregnenolone, sulfate, adenosine, asymmetric and symmetric dimethylarginine, that in the end, as a model in its set, outperformed multimodal CT imaging to differentiate these two entities. So clearly this study was designed to come up with a diagnostic panel, a diagnostic set of metabolites. So we didn't dive too much into how each of these individual metabolites would be linked to stroke pathophysiology in its functional role, what the mechanism would be, why particularly this metabolite would now be elevated in its circulating levels or decreased as for adenosine. So, but there's clear links that have been identified by previous literature. For example, pregnenolone sulfate is a metabolite that is linked to the acute stroke, to the acute stress response. ADMA and SDMA, so asymmetric and symmetric dimethylarginine, are clearly linked to also to vessel contraction, vasodilation, to the nervous system. And adenosine obviously is also very well known for its role on vessel biology. So we clearly have the idea that this is something that is happening because there's a vessel occlusion and the response within the vessel afterwards. It's not so much that we believe currently that this is something that is associated with the early neuronal injury, which will also be very helpful. And this is something that we also currently set out to further focus on. But these 4 metabolites that came up by just that's what came up. We believe is rather due to the fact what happens within the vessel after stroke. So what is the next step now for specifically these 4 metabolites? And obviously, so this is something that needs to happen in the acute phase. The patient comes in with symptoms and we need to make a decision now. We need to ideally, every minute that passes, neurons die and we need to treat the patient. So this is something that requires not time-consuming technology such as metabolomics, but that requires point-of-care devices that are designed of helping us or giving us a result within maximum a couple of minutes, ideally. And this is something that we're currently following for these 4 metabolites. So for 2 of these metabolites, asymmetric and symmetric dimethylarginine, we're already able to perform absolute quantification of them with another site. And we're currently setting up also assays for this for pregnenolone sulfate and adenosine, but this is still then far away from a point of care devices. There is development in technologies But this is something that we need to pursue and that we need to develop. It needs to happen in the early phase within a couple of minutes, but we're still far away from that.